Should you be afraid of Medicare Open Enrollment 2020? Well, we're going to talk about that in a moment. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. The problem with the Medicare Open Enrollment for 2020 that starts on October 15th, 2019, ends on December 7th, is the new Medicare Plan Finder. Yes, sir and ma'am. It seems the folks at CMS decided that the old Plan Finder, which was reasonably functional for at least a dozen years and probably longer, needed to be overhauled. So what did they do? Well, they fired the old folks that the old firm that had designed and managed the Medicare Plan Finder in the past, and they hired somebody new. This is reminiscent of when the government decided to get into the under 65 health insurance market, and they came up with healthcare.gov and awarded the contract to somebody who had never done insurance before. You know, who knows what goes on through their minds. But in any event, the new Medicare Plan Finder is essentially non-functional. If you want to use it, because it's pretty and and stuff like that, well, you go right ahead. But I've got news for you. If you're looking for the lowest cost drug plan, and lowest cost that's total cost now, which is premiums plus copays. If you're looking for reports like we've had in the past, you're not going to find them on the new Plan Finder. For some reason, the folks at CMS, who supposedly thoroughly tested this new software and pronounced it ready to go, never bothered to see if the results that you could get were helpful, which they're not. And this becomes even more challenging if you want to compare drug cost between a plan that's built into a Medicare Advantage plan with a standalone Part D plan. You can't do it. All right, now I'm going to qualify that. If you are a Medicare beneficiary and you are logged in to the new Medicare Plan Finder, you can go back and forth because your drug plan information is automatically popular. Your drug information, drug history, is automatically populated when you log in as the Medicare beneficiary. So anybody who helps you, somebody with an insurance agent such as myself, somebody who tries to help you, somebody who's helped you in the past, a volunteer at a church or some other organization in a library or a school, somebody that has helped you in the past, unless they are logged in as you, they have to input your drugs manually every time there is a revision. And that is a time-consuming process. Plus, you may accidentally leave something off, and then you have to start all over again. So in addition to not being able to get any results when it comes to total cost, again, that's premiums plus copays, you can't get that information anymore. It's just not built in there. So what's the solution? Well, you can do it yourself, and good luck with that. Yogi Berra said if you don't know where you're going, you might end up somewhere else. And most folks do not really understand Medicare Part D. They don't understand Medicare Advantage plans, and they don't want to. They say, I've got things better to do. I've got gardening, I've got golf, I've got trips to make. I haven't got time to learn this. And I agree with you totally. There's no reason why you should have to be an expert at this. But unfortunately, the only way that you can log in and see all this information without having to input things like your medications and so forth, the only way you can do it is to do it all by yourself. Now, you may say, All right, well, I can just share my login username and password with somebody else, and they can help me, can't they? Well, you can. Medicare warns you not to do that. They say don't share your username and password with anybody. You might want to trust a relative, but beyond that, somebody you're talking to on the phone. I'm on Medicare myself, and I personally would not share my username and password with anybody. And there's a couple of reasons for that, not the least of which is your username and password for the Medicare Plan Finder is exactly the same one as your My Medicare account. So if they can log in, anybody can log in and see your prescription drug history. They can also access your Medicare information, your name, your home address, your Medicare number, your doctors, all your claims for up to the last 3 years, and know who your insurance carriers are. Now, isn't that wonderful? Is that the kind of information that you want to give out? Probably not. And of course, Medicare says, well, there's a solution to this. Just sign up and put a blue button, My Medicare blue button, on your phone or on your tablet, and that way you don't have to log in. The app does it for you. Well, that's kind of scary. What if you lose your tablet? What if you lose your phone? What if your tablet or your phone are not secure and somebody gets it? Well, then they've got access to all of this information. Think about that for a minute. It's a pretty scary thought, and not to mention the fact that apps for tablets and phones are notoriously insecure. There are stories almost daily of apps being hacked, used to hack into user accounts because they got access to, there was a security flaw in the app, and somebody was able to log into your bank or your credit card information, or personal financial information, or your health information, such as on mymedicare.gov and your Medicare Plan Finder. So there's situations like that. Some of the apps also, I'm not talking specifically about Blue Button, I'm just mentioning apps in particular. Some of the apps also have spyware. So even if they don't do something nefarious with your Blue Button app, well, they could then use it to find out all kinds of things about you. It's just, and right now, this is October 1st of 2019, there are, I think it's 18 different vendors out there that have created My Blue Button software. And there are some 1,500 approved companies that are, 1,500 companies that are approved to develop My Blue Button software. This is insane. This is absolutely insane. Your Medicare information should be the most private of anything out there. But yet, it's being relegated to My Blue Button, which only 3% of people on Medicare even knew what Blue Button was. All right, let's get back to all of the other things. I mentioned earlier that you should not share your username and password with anyone. Medicare says don't do that. But if you decide, this seems like such a nice person, and I do want them to help me, I'll just give them my information. Well, okay. They're not supposed to store this information, even if you do give it to them, which you really should not do. They're not supposed to store your username and password anywhere. They can get in trouble for doing that. So if you talk to somebody on the phone, or somebody comes to your home, or you go to their office, and today you say, all right, my username and password is blah, 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 blah. and say, okay, not a problem, let's do this, and so forth. Well, then a day or two later, you decide, you know what, I think I'd like to look at something a little bit different. Unless they're asking you again for your username and password, that means they've stored it. They may have stored it in a place that's unsecure. It may be in a steno pad right beside their computer, for all you know. It could be somewhere on their computer in an unsecure file. So even if you believe that your information is secure with Medicare.gov and through the Blue Button app, well, what about the person or persons that you have shared that information with? Is their computer secure? I mean, I can go on and on and on about the problems associated with, but basically it boils down to, if you're interested in a drug plan, either baked into a Medicare Advantage plan or a standalone drug plan, Medicare Part D for 2020, you will not be able to find which plan has the lowest total cost. It's just not available. So what do? Well, some of us, myself included, have contracted with an agency that has purchased a license for the old Plan Finder, which is capable of running these reports. So all of my clients, all of my Medigap clients will have access to this particular agency, and they will be glad to run reports for you and help you out, help you find the lowest total cost plan and enroll you in a drug plan. So that's my solution to it. I don't know what the other agents are doing. Most of them are just complaining and saying they're not going to do drug plans anymore, and they're not going to they're not going to give information out on drug plans that may be baked into a Medicare Advantage plan, because there is a lot of liability there on their part for giving you bad information. Well, that's kind of a two-edged sword, because if you can't get the information, how can it be bad? Anyway, mixed bag there. Well, all right, this is my warning. This is my message. Sorry it has to be so gloom and doom, but it is what it is. But this is my warning about Medicare, the Medicare Plan Finder for the 2020 Open Enrollment. You take care and try and sleep well. Have a great day. Bye-bye.